We begin the physician workflow after the patient has checked in and the nurse has already entered the intake information. Over in the left part of the clinical screen, you see the schedule carries over from the practice management program, and that's very convenient because it allows you throughout the course of the day to see where you are. At this point, we know that a patient has arrived and the ball is in my court on this patient because the name appears in big green letters, and we also can see what room they're in. So I'm going to go ahead and click on that patient to open up David Blackwell's chart. Throughout the course of the day, I can see that schedule refreshing, so it's a great indicator to know if I'm getting behind. Now I see that the nurse has entered that the patient is here for a follow-up for diabetes and sinus pain. So I want to begin by selecting diabetes on the patient's problem list. That opens up the auto visit window. Auto visit is a self-learning tool. It's part of the program where it learns how you treat certain problems. So it's learned that in the past, these are the things that I've done to address diabetes. Obviously, we notice right away that some things are in red. Those items that are in red appear in red because on the patient's preventive care profile, there are certain things that are overdue. And based on the patient's problem list, medication, age, sex, smoking status, and even insurance, the program knows what needs to be done and how often it needs to be done, and so it can determine that some things are overdue. So I want to go begin by selecting the things that are in red. I can't go wrong with that. Now I'm going to go ahead and choose urine strip, and by ordering that urine strip, it's going to do a couple of things. First, it's going to document in my note. It's also going to send it to the billing system so I get paid for this, and it's also going to send a note to my nurse because it's configured that this is a procedure the nurse does. So just by that one click, it does all those things. A1C is in blue, and blue indicates that I had previously ordered this test, but the last time I ordered it, that the results have not come in. So my assumption is that the patient never got this done, so I'm going to go ahead and reorder that. Also notice in the upper left, the program associates problems with exam profiles, and so it assumes that I want to do my typical diabetic exam. I'm going to go ahead and click OK and select that. And so you can see that just by a couple of clicks, it is already beginning to build my note, and it's got a really good start to doing that. Now I can see that my normal diabetic exam includes a foot exam. I didn't do that today, so I want to take the foot exam out of my note. And I also notice that the patient has a murmur, so I want to document the murmur. Also, this patient is obese, and so I want to make that change to this patient's examination. Now, if I want that to be my default for my diabetic exam, that is, if more often than not my diabetics are obese, I can tell the system to remember that with a couple of clicks. And now, by just doing that, the system will indicate that my patient, anytime I do a diabetic exam, the patient is obese unless I say otherwise. And so it's building it. It's building the exam as you go. It's dynamic. It's a whole lot more flexible than just using a template or a voice recognition system. So I want to, at this point, document the history. The easiest way to document history is to pull over the last time I did a history on this patient. That's going to save me from having to start all over again. And the patient last time said he was exercising 3 times a week. Now he says he's really only down to about twice a week, so I'll make that change. He still is compliant with his diet. He's not compliant with his medications. So I'll go ahead and leave that history as it is. And again, all of the history and exam forms have a place for you to do free text if you want to supplement the text the system is generating, as well as use voice recognition. So with just a couple of clicks, I was able to document a pretty good history. So the next thing that I want to do is I want to actually treat this problem, and if I go back to my overview page, I can see that the patient is on metformin. I want to increase metformin from 500 milligrams to 1,000. I can do that with a simple right click and change the strength, and I will choose 1,000, and that will do that. If I take a look at my note, notice at the top of the note that it indicates that metformin has been changed 500 has been stopped and 1,000 has been started. That's also reflected in the assessment and plan part of the note. Now at this point, I want to go back to auto visit to see what other things I may want to do, and I want the patient to increase his exercise again, and he does need to lose some weight, so I'll do that. And I'm also reviewing his lab results with the patient, so I want to indicate that in the note. And I think I'll also refer this patient to a dietitian. And so by doing that, the program opens up a window and says, here's the dietitians you used in the past. I'll go ahead and select that first one. And again, if we scroll down and take a look at my assessment and plan, it's pretty thorough at this point. Now, the next thing I want to do is I want to address hypertension. So I'm going to go ahead and select hypertension. Again, the program opens up auto visit, and there are some things that are in red and overdue. So I'm going to go ahead and choose the things that are in red, and I will click OK. And I think just like I did with metformin, I think I'll increase his lisinopril from 5 milligrams to 10 milligrams. So I can do that with a couple of clicks. And then I will go to, if this patient has asked about, does this increase his chance of a heart attack? So let's take a look to see if we have any handouts that might be worthwhile to give to the patient. And so here's a handout that comes with the program. There's over 3,000 high-quality handouts that come with the system. I think I'll choose that handout and give it to the patient. And those handouts are updated every year. You can search on keywords or diagnosis-related handouts. It's very, very helpful to do that. And then finally, I think I'll address hyperlipidemia today. So I'll click on hyperlipidemia, and he's overdue for a lipid profile, so I'll order that, and I'll also check his liver. And so once again, you can see that the program is generating the assessment and plan as we go. And finally, this patient has complained about sinus pain. So let me document sinus pain. I'll go ahead and click sinus pain there. And the easiest thing to do is I'll select a sinus pain preset so I don't have to answer all of these questions, start from scratch every time. So I have my associated symptoms that are already a part of what I've done in the past for sinus pain. And so I'm just going to make some changes for this patient's history, and he complains about it for 2 weeks, and save it, and let's take a look to see the history that we got generated. So my history was generated pretty easily with just a couple of clicks. And now I do want to make a diagnosis, so I'm going to open up my diagnosis form. This electronic encounter form is a counterpart to your paper encounter form. It's completely user definable, so you will want to set this up to make it pretty much mimic the flow of your paper form so that you're used to it. It's not something totally new. And I want to say the patient has sinusitis. The program now tells me that I've documented a complaint of sinus pain. And so it's asking me, is this related to that? And of course it is, so I want to go ahead and do that. And since smoking cessation is in red, I will go ahead and order that. Now I think what else I want to do here is I will, for sinusitis, I notice the patient is allergic to penicillins, so I think I will choose from my favorites list. Makes it real easy to prescribe medications that I do over and over again. I will go ahead and choose Bactrim. The program now pops up a warning saying that there is an interaction here with the ACE inhibitor. I'm going to ignore that warning because this is a 7-day prescription, and so I'm not too concerned about that. And so if I take a look at my notes so far, we can see what we've done there for sinusitis. Now, in addition to that, I want the patient to increase his fluids and take Tylenol for pain, and to call the office if his symptoms persist. And so again, I'll take a look at my assessment and plan, and that's pretty good. So the last thing that I want to do now that I'm done documenting this visit is I want to close the visit. So I'm going to click on this close the visit button, that opens up a summary screen, and the program looks at what I've done, the length of time I spent with the patient, and the complexity and of the information that I've entered, and it recommends level 4. So I'm going to go ahead and leave that alone. Now what we found is that when physicians begin using the program, or prior to them using the program, they average about 20% of their visits are level 4s. And after they've been using the program and become proficient with it, that number increases to over 50%. Now that's really significant, since the difference in reimbursement between level 3 and level 4 is somewhere between $30 and $45 per visit. So you can see, going from 20% level 4s to 50%, that adds up pretty quickly. In this closed visit window, if I want to send any additional message to the nurse, I can do that. The nurse is already going to get a message telling her to do that urine strip. I could do an additional message to checkout. One thing I do want the checkout to know is I want to see the patient again in 3 months. And because the patient is due for a physical, again, you can see it over here, it's in red on their preventive care profile, I want to tell the front desk that I want a physical for this patient. So I will go ahead and click Save here. And the next thing that happens is it brings up my electronic confirmation window. So that's for my metformin. I want to say yes, go ahead and send that. And lisinopril, go ahead and send that. And Bactrim, if I said no, I could print the script on that if I wanted to. But I'll go ahead and say no on that. Then it prints my lab requisition, and it prints a referral slip that I can give to the patient. And the next thing that it prints, the last thing that it prints, is a visit summary. This helps you to fulfill the requirements for meaningful use. But it's also a really good idea just to improve patient care. So, and it's automatically generated based on what I've done. And the last thing that comes up is the system recognizes that I've sent this patient to a specialist, so it assumes that I want this specialist to get a copy of today's note. And all I have to do is click OK there, and by doing that, as soon as I have signed this note, when I'm finished with it, it's going to release a template letter to go to that specialist, saying that you know, I'm referring this patient to you, and for what reason, and then here's a copy of today's note. It's going to include that right in the letter. That happens automatically, doesn't require anything else for me to do. All I had to do was say yes, go ahead and do that. Now it's great for primary care specialists referring, or primary care physicians referring to specialists. It's also really helpful for specialists, because typically in their case I'd want the copy of their visit note to go automatically to the PCP. But at this point, we have completed our provider workflow.